Joining us now live with more is pediatrician and founder of Kid Crew, Dr. Dina Kulik. Doctor, nice to see you this evening. I'm wondering if these new guidelines, so the guidance from the province's medical officer of health, the chief officer, if you're okay with these new guidelines.
I'm kind of on both ends of it. I'm hearing from families today that some are really happy that their kids won't be tested endlessly for runny noses because these are seen to be more minor symptoms of COVID-19. On the other end, I'm hearing from lots of parents that they're worried that there'll be more kids that are sick at school because they have these more minor symptoms. And we know that some kids, lots of kids that have COVID, adults too, are asymptomatic or very minimally symptomatic. So there's no doubt that some people with COVID have just a mere runny nose and they don't have fever or cough.
Right. And I guess, we don't necessarily always have the breakdown on the numbers, when you get the diagnosis. I was surprised to see headaches taken off the list because, often with a fever, you get a headache. Is that right, doctor?
That's true. Many kids, when they have fever, have headaches, but fever is on the list. So if your child does have fever or difficulty breathing, cough, loss of sense of smell or taste, or gastrointestinal symptoms like belly pain, nausea, or vomiting, those kids need to stay home. But the ministry actually went further and said any viral symptoms, kids should stay home as well and test and isolate. But it's about returning to school that, symptoms should be improved or not worsening and have a COVID test that's negative.
Do you think that maybe in the early days of the pandemic, or even not so early, there were so many times, people had to rush their kids home from daycare, get them home from school because of a runny nose that turned out to be nothing? I mean, are you feeling that we might have overdid it in the beginning and this is just maybe the proper correction?
I don't actually. I mean, most of our patients at Kid Crew that had COVID had very mild symptoms or no symptoms, many that had just a runny nose and that's it. So there's no doubt that many kids are minimally symptomatic or asymptomatic with COVID infection. So it isn't a be all and end all if you have no runny nose, or rather if you just have runny nose that you necessarily don't have COVID. That isn't the case. But far more children were tested for just a runny nose than actually had COVID.
It's going to be, I guess, interesting to see the impact that this will have in the classroom. How concerned are you going forward now with guidance or no guidance with the schools opening on September 9th in the presence of the Delta variant?
I am worried on one end, but I think we don't need to panic. So we've certainly seen a huge rise in viral illnesses over the last couple of months, much more than typically we see in August. Granted, most is not COVID. There's a lot of RSV virus and others. And I worry that if we have a little bit of COVID in these classrooms, if we can get these other viruses spreading amongst kids as we already have, potentially that will lead to rising counts of COVID. So we really should be wearing our masks and keeping our distance and being outdoors more and washing our hands and staying home if we're sick at all costs.
All right, doctor, thank you so much for your time tonight and your advice. We appreciate it.
You're welcome.